Hello ladies and gentlemen, I'm Dr. Marc Smith, Natchez Trace Veterinary Services, and I wanted to bring you this video today to tell you about that fine critter right there. That's a good looking dog. That's Waylon?
Waylon.
Where'd that dog come? What's the history?
This dog is an Australian cattle dog. He's a miniature.
How old is he?
13 weeks.
13 weeks. And so what I'm doing today is I'm going to tell you how we approach these little puppies and what we do so that you have clarity on the best way to treat your puppy, because everybody needs to know that. Okay, so Waylon, let's say you came into me, and by the way, this is Leah. This is our new employee. Leah's wonderful. She's an Oregonian.
Thank you.
If you don't know what an Oregonian is, that's somebody from Oregon. I'm a Nashvillian. That's somebody from Nashville. She's an Oregonian, and I make fun of her for that. But anyway, so we're going to take sweet little Waylon here. He's a good dog, and we're going to go through an exam kind of, and what we do on him as far as if he came into the practice and how I would advise people to do what they need to do to take the best care of their puppy. So the first thing we do is most puppies we recommend they come in at 6 weeks. And 6 weeks is the time when the maternal antibodies or the mommy's milk is starting to go away, and it's usually the first time we administer a vaccine series, okay? And so what we do, we start with an exam. We look at the puppy's teeth and see those little teethies line up, and then we look back in his mouth. We make sure he hadn't eaten a stick or swallowed something he shouldn't swallow. These little puppies, they eat stuff all the time. You all know that. And we look in there, then we look in his ears, and I'm not going to use my otoscope, but see, his ear's a little dirty. You need to clean this dog's ear. Okay, and then we squeeze around on the base. See, he's a little bit painful right there, okay? And usually what that is that's a smoldering little infection, because a lot of puppies get it. They're not very efficient at cleaning their ear canals, okay? And so what'll happen is they'll get some debris build up, and then that buildup will usually lead to yeast growing, and yeast is a little painful. And then what we do is we check their lymph nodes, and then we turn them around this way, and we palpate their belly. We feel their umbilicus for umbilical hernias. A hernia is a rent or a place in the body wall, kind of like belly button hernia. That's what it is. Your umbilicus is your belly button. Then we'd listen to him. We'd look at his skin, make sure he doesn't have any fleas. Lots of puppies will have fleas. We check him for musculoskeletal abnormalities. We check his kneecaps. We check his pecker. And then we check his balls, and we make sure he has 2 testicles down. I'm sorry if I said balls. I apologize. Testicles. We check his testicles, make sure he's got 2 down. Some puppies will drop their testicles later on in 6 months, something like that.
So
some of them will retain a testicle. When an animal has a retained testicle, it's called a cryptorchid. That's a different surgery than just a regular castration. In horses, we call them high flankers sometimes. Anyway, so then we palpate him, and we look around, we look at his rear end and all that. So then we move on to the most important things outside of the exam, which is going to be vaccinations and when to vaccinate, and parasite control. So on vaccines, it doesn't matter about vaccinating your pet unless you evaluate the risk factors. Vaccination is all about risk. Okay, so if you have a dog that has no risk for the disease, then there's no sense in vaccinating him for it, right? Doesn't that seem reasonable? Okay, so, but with puppies, they're constantly exposed to disease and illness. Parvovirus, that's the big bad one. Parvovirus afflicts many dogs, especially puppies in shelter situations. It causes massive diarrhea, vomiting, not feeling good, bloody diarrhea, and ultimately about half of them die. The half that you save, generally you have a really big bill. So the point is that these little puppies need to be vaccinated, and they need to be vaccinated diligently. They need to be vaccinated by people that know what they're doing. Okay, the reason why we have a series of shots, this is an important question. We have a series of shots is because we don't know when the maternal antibodies go away, and we're trying to time that. So when we give a shot, the maternal antibodies, that's what comes through their mommy's milk when these little puppies nurse. If those maternal antibodies are high, then the shot doesn't provide an immunity building incentive to the puppy's body. So that's why we got to give multiple shots. So the way I typically do it in my practice is I do 3 vaccines, 7, 10, and 13 weeks. Then I do a rabies at 15 weeks. And that's just what works for me. Okay, I don't vaccinate for lepto because most of the dogs in my practice are at no risk. If you're at risk, then it's okay to vaccinate for it. But the veterinarian and you, the pet owner, have to make that decision. So vaccinating pets is not simple. It's not straightforward. A lot of thought needs to go into it. And you don't need to make each dog fit the same mold because that's not the best way to do it. So that's on vaccinating. So on these puppies, we usually do it 7, 10, and 13 weeks on a distemper parvo shot, and then we do rabies after that at about 15 weeks. And every once in a while we got to make adjustments, but that's about it. Now on the parasite test, okay, that's another test. That's when we stick the old rod up the rear end and look at it under a microscope, look at the sample under the microscope. What we do in that instance is we do deworm the puppies with a straightforward dewormer like Strongid, okay, every 3 weeks. The pre-patent period, do you know what that is?
No.
The pre-patent period is the time when a puppy gets infected to the time they shed eggs on the parasite test. Okay, so a dog can actually be infected, but we can't tell it. We do run a parasite test on every puppy. Why?
To see if they're infected.
To see if they're infected, and because every medication we give doesn't kill all parasites. It's not smart, and it's not in your dog's best interest to give them medicine when they don't need it, okay? And a lot of people do that. They just pile in this medicine in these puppies to kill every parasite we have. Well, the problem with that is a lot of puppies don't have parasites, number one. And then number two, another problem with that is that, I mean, one basic premise of medicine is that you don't give medicine unless it's warranted.
Right.
That's why we have all these problems, okay? So we run fecal test. We'll do 3 of them. And then we're also going to deworm your dog, okay? And we're going to deworm it prophylactically because of that pre-patent period that I just mentioned. Puppies get infected, they go out and roll around in the grass, they sniff another dog's rear end, they eat poop, they eat stuff outside, and they get constantly reinfected.
Right.
And when we run our test, a lot of these eggs won't be shed during that 3-week interval, okay? So that's why we do that. So, do you have any questions about your puppy?
No, I do not at this point.
Are you sure?
What age should I castrate? Neuter.
Well, that's a good question. So, and it depends, okay? There's a lot of different, this is really important too that you need to know, okay? So when you talk about castrating and neutering these dogs, and even spaying these dogs, okay? When you do those things, we're doing that to prevent unwanted behavior and to prevent unnecessary production of puppies, right?
Correct.
But there's some consequences to doing that, okay? And this is going to irritate some people. But anytime you cut off the supply of testosterone and estrogen in a dog, that's what we do when we spay and neuter them, right? We're pulling those organs out that produce those hormones. Well, those hormones have an importance, you know? And after 20 years of doing this, instead of us having an epidemic of obesity in dogs just spontaneously, we have fat dogs because of 2 reasons. Number one, they're spayed and they're castrated. We're taking the driving force for their metabolism away, and we're feeding them a highly concentrated processed food that packs calories on.
Right.
That's why.
Okay.
So there's consequences to spaying and neutering your dog, okay? Or cat, it doesn't matter.
Right.
Another thing is, I think, you know, taking the estrogen away that the testicles and ovaries provide leads to more soft tissue injuries, because we know that estrogen is what makes a female's hips go from yay to yay when they have a baby, right?
Right.
And be, move around and all that so they can accommodate the, the developing fetus.
Right.
Well, when we take those away in our dogs and our kitties, especially dogs, then the elasticity in those tissues, those cruciate ligaments is gone, and so they can tear them a whole lot faster and a whole lot easier. That's my belief. Some people may say I'm crazy, but that's what I think. So it makes sense to me, and I think that same model is following along in humans, where there's pretty predictable times at which a female tears her cruciate ligament based off her menstrual cycle, and typically it's when that estrogen is the lowest. Okay, so we hadn't proven it out in dogs yet, but that's what I think. So
do you think ovary sparing or?
well, I'm not saying that necessarily, but what I'm saying is I'm not sure that to arbitrarily say, oh, we spay your dog at 6 months every single time is the best way to do it. I think it's got to be calculated. I think it needs to be thought through. And
Bigger dogs leave intact longer?
Huh?
Bigger dogs, bigger breed dogs, would you leave intact longer?
Well, it depends on the owner and what they want and what their goals are for their pet. But I'm here to make medical recommendations, and that's what I do, and that's what I do best. And so it just depends, but it's my job as a veterinarian to take you through these scenarios. So, all right, well, if you've got any questions about how to take care of a puppy, this is a good-looking dog. Everybody's just gone bananas over him. I thought about taking him and you giving him to me.
Yeah, then he'd be unruly.
No, he wouldn't. I'd have him in line. He'd be doing exactly what I said. He wouldn't be doing that, would he? So, anyway, thank you for watching. If you have any questions, you're welcome to email us or look us up on the web, or you may be finding on this web, call us if you have any questions about how to take care of your puppy. But that's what I found to be the best way to approach a puppy in 20 years of doing it and treating tons of puppies over my career. So make your choices diligently. You need to vaccinate what you are or what your puppy's at risk for. Test for parasites. Don't arbitrarily give medicine. That's a mistake. And then you'll have a happy, healthy puppy, just like Waylon. So say bye-bye, Waylon.
See ya.
Bye-bye. Bye-bye. See you, sugar.